I'm Dr. Lynanne Foster, orthopedic surgeon specializing in sports medicine at the Woodlands Specialty Hospital. The Woodlands Specialty Hospital is a small private hospital, and I feel like my patients get a lot of individual attention there. So for example, a patient will come into the office, and should they need an MRI or other diagnostics including imaging and/or labs, then they can get that done the same day, and it's less time off work and more time spent doing the things that they like to do. I'm also able to get scheduled in the OR very quickly. Most of my patients are outpatients so that they're able to go home the same day. And I think that's really a better way to do things whenever possible, because it's much more comfortable to go home and sleep in your own bed that night. And people feel better, there's less risk of infection, and there's less expense than having to stay overnight in the hospital. Of course, we do have those facilities available for anyone who needs it. I did a fellowship in sports medicine, so I've worked with the Rice Owls and the Houston Comets in my career. I've also done some teaching of residents where I instructed them how to do these surgeries. So that's really what I do the most of, including arthroscopic rotator cuff repair, a lot of knee surgery, but I've worked at level 1 trauma facilities as well, so I'm comfortable with whatever happens to come in the ER that day and take care of that. In addition, I do general orthopedics, except for spine. Another exciting procedure that I've incorporated into my practice is the partial knee replacement, and I've even done this surgery on my assistant, and he's done quite well. He's someone who's on his feet all day, and it's enabled him to continue with the things that he enjoys doing, as well as go back to work very quickly. It's a great surgery for people who have some arthritis in their joint, but they're still too young for a total knee replacement.
My left hand, I went in and had my carpal tunnel and trigger thumb done. And he kept me in a brace for over a month. And with Dr. Foster, I went in and had my right hand done, carpal tunnel and trigger thumb. And she didn't put me in a brace, and I recovered much more quickly. And with my left hand, I had to go to physical therapy for months afterwards to even get my thumb and my hand to work right. And I was in constant pain for a long while after that surgery. And now I'm not in any pain with my right hand, and I just had it done in July.
Dr. Foster is very commendable because she seems to genuinely care, and I think that sincerity comes across in her treatment and care for her patients. And then not only does she care, but she gives you enough time so that you can share and ask questions to have great direction on what you're doing. This is one of the few places that you go where the waiting time is minimal. You have paperwork that needs to be completed, but usually once that's done, you'll be surprised at how they will usher you and move you to the next place. And everybody's so gracious, you know, gracious and kind. So even though, yes, you have needles and stuff, it's less offensive when people do it kindly. If you want great treatment and people who sincerely care about you being restored to your previous level of health and fitness, Dr. Foster is the person to see.